of these is correct? Which one of these is best? And the answer I would suggest is they are all correct because they're all pieces of a larger puzzle, but we have to always make it very clear which piece we're talking about. So I've been arguing recently that resilience is kind of an umbrella term for a whole range of processes, and we're calling this the temporal elements of psychological resilience. This was a paper we recently wrote, and we use this phrase, and I like this phrase because it tells us that things happen over time and there are different elements, and each one of these are pieces of this broader puzzle of resilience, and it's very important that we're explicit about which piece we're talking about so that we can understand what we know and what we don't know and how we go forward. So this framework, this is kind of a framework we proposed in this recent paper as a way to integrate a lot of the work we've been doing. And I originally came up with this because I was asked to try to integrate the literature on individual, family, and community resilience. So we wanted to go simple. I like simple models. And this is actually really simple. I'll walk you through it in a second. And when you get simple, you sometimes realize we actually don't know even all of this. And I was kind of surprised about the literature on family and community resilience because there were enormous holes in that literature in terms of a simple model like this. There are lots of areas where we just didn't know. And so this model was useful in that regard. So we begin with the notion of time. Everything happens over time. We can only think about resilience over time. And this is I'm going to go through this just quickly. It's fairly straightforward, maybe too straightforward. First of all, resilience to what? So we always have to say, what is the aversive circumstance we're talking about? And here are two very, very cursory kind of categories: acute events and chronic events. Very straightforward. There are obviously other things, and in today's meeting, people brought up finer-grained pieces of each one of these larger categories. Then, what is the outcome? So we have to have some way to measure resilient outcomes. We need some measures of health to dysfunction. And if we have only these two kinds of stressor events, we actually do see two different outcome patterns that we can consider resilience. And Anne suggested something along the lines of this top pattern. I'm sorry, the top pattern, right? Emergent resilience, which we are calling emergent resilience, just to give it a name. And this other pattern, minimal impact resilience, and I'll go into this in just a moment. Then we have to consider adjustment prior to aversive circumstances. This is quite doable, actually. We've done quite a few studies now where we have data before the aversive event. So we need some measure of baseline or pre-adversity adjustment. And if we have that, just with two different outcome patterns, we already have a whole lot more complexity, because you can see there are lots of different possibilities of what will lead to these outcome patterns. And I'll show you data that shows a lot of these different patterns. And then the question about predictors, and we can look at predictors at any point along this continuum, things that we bring to the event, things that happen during the event, and things that happen after the event. So a few considerations about data and design. There are a lot of resilience scales floating around. I don't know how much currency they have in the child development literature, but people are using scales with the name resilience in them. And they purport to measure characteristics and qualities that predict resilience. But I'm not a big fan of these scales because they're not clear. They're kind of vague. I'm not aware of any evidence showing that any of these scales actually predict resilient outcomes. I don't think that's ever been done. And until that's done and validated, it's not clear what they're measuring. The other thing is that they do seem to have a personality characteristic. And my colleague at Columbia, Walter Mischel, has argued for many, many years that personality doesn't explain very much. It explains things, it's predictive, but it only explains a very small percentage of the variance. So if we're measuring resilience by a scale, we're not getting very far. What about cross-sectional designs? It's hard to do this kind of work, so cross-sectional designs are appealing. This is a paper I published in 2004 summarizing my understanding, my best sort of estimate, almost really a hypothesis about what the different trajectories of outcome we would see after potentially traumatic events. More recently, we've done a lot of work on this over the years, and we have now a lot of data on various trajectories from various different samples, and this is a more updated version. It's also prettier. You can see that this trajectory on the bottom, which we're calling resilience, I don't think it's a very informative word, but that's what we've been calling it, is the modal trajectory almost all the time. It's typically, in a lot of studies we've done, the majority of participants in the studies show that pattern, and it's almost always the most common pattern. But what's interesting about looking at this kind of heterogeneity, when one of the things I've tried to do in all my work is to follow samples over time and try, as best we can, we try to get population samples or representative samples. When you do that, you also notice that there's more than just resilience and pathology. If we look at this upper part of the graph, the top line, the green line, is probably what would be chronic PTSD or something like that. But you can see there are other patterns, and there's variability in those patterns over time. So if we measure those things cross-sectionally, we're going to get a very different picture of outcome. But more importantly, we know very little about those patterns. We know very little about what predicts differences in those patterns. We've done a little research in my lab on emotion regulation type variables that do predict, we measure early on, predict which direction people go, but that's really about all there is. There isn't much, and I'm a little bit surprised by this, and it's something we try to do more of in my lab right now, because these are important clinical questions, how these people, what are the fates of these different groups, and what can we know about them in advance. I'm just going to show you this quickly, because we've done a few animal studies. My student, Isaac Gallitzer-Levy, who's now a professor at NYU, a very talented guy. We did this with Joe Ledoux, and this was some extinction data that Joe had. And you can see if you actually apply the same kind of trajectory modeling, I haven't told you how we do this yet, but I'll tell you how we do it in a minute. You get actually these nice individual difference patterns in extinction. And you can see some of the the rodents never extinguish, some extinguish quickly. So you see these similar patterns in animal behavior as well. This was a cross-sectional study that we did. I'll tell you the data and I'll tell you the limitations of it. This was work I did with Sandro Galea, who's just one brilliant guy. He's an epidemiologist. He was the head of epidemiology at Columbia. He's now gone on to Boston University as an administrator. But they collected, in the first 6 months after 9/11, they collected 3 samples of data at 3 different times, and each time they got representative samples of New Yorkers, which is very, very hard to do because New York's an ethnically diverse city. And we used those data to look at post-traumatic stress disorder across different kinds of exposure, and this is what the data looked like. And then we characterized people as moderate to severe psychopathology, and then we characterized people as resilient based on 0 or 1 trauma symptom. So if you look at, there's almost no data on what trauma symptoms are like in the normal population. There are data on PTSD, but not symptoms. It turns out that a lot of people have a couple of trauma symptoms. So you hear in the media, soldiers are coming back from Iraq with trauma symptoms. That's completely meaningless because the normal population has trauma symptoms. They're not really symptoms, they're just difficulties that happen to also be on the PTSD diagnosis. So we did this, and it was interesting. We found lots of interesting predictors, but it's really limited in a lot of ways, and here's why. We like normality. We think our data should be normal. We assume our data are normal. And most conventional statistical approaches require normality. However, when you have something like post-traumatic stress, it's never normal. It's never normally distributed. It's always positively skewed like this. So that's a problem. So if you transform it, you've lost a lot of information. That's not such a big problem if you're talking only about PTSD, which is why I think one reason why this hasn't been noticed. But it's a big problem if you're talking about resilience, because then the question is, where does that line go? And you can see by where I put it, it's a little bit arbitrary. Where does that belong? So we need to know more about that distribution. Here are 6 distributions from 6 different events, different outcome measures. You can see they're all positively skewed like this: depression, PTSD, whatever else they have under distress. This one is post-traumatic stress symptoms 1 month after surgery for traumatic injury. This was a data set we collected. And you can see it's not normally distributed. It's positively skewed. But you can also see, if you look at it, that it's not, it's multinomial. There are different groups that you can kind of see embedded in there. So the question is, are those real groups? What's going on there? And we now have methods. Anne mentioned this latent growth mixture modeling. And I learned how to do this about 10 years ago, and it's really been a lot of fun in a lot of ways to do these kinds of analysis. And what latent growth mixture modeling and similar approaches, this is probably the best of the suite of approaches, it finds normal distributions within a non-normal distribution. So you can see the normal distributions, it's finding groups that are clustering together in a normal way in a non-normal distribution. But with mixture modeling, this is happening over time. So we're finding groups that are moving over time, clustering together, and we can identify them as a coherent group because they are clustering around a normal mean. So just a couple of quick studies to show you what we do with this. This is something called a German panel data set. This is a data set that Germany collects on its people. This was 17,000 people followed over about 20 years. And they make this data publicly available, which is easier said than done. It's very hard to work with these data. But this was a study Andrew Clark, who's at the Paris School of Economics, and Ed Diener is a social psychologist. They looked at life satisfaction in the years before and after these events. So this is widowhood, the death of a spouse. And you can see that this looks about right. On average, the life satisfaction drops, and the orange line is the year the spouse died, then it goes back up. So we reanalyzed these exact same data with Andrew Clark as one of the collaborators. And we found there were 4 trajectories. What that means is there are 4 separate groups embedded in that distribution, each normally distributed. So they're coherent groups embedded in this non-normal distribution. And 21% showed a trajectory that's a lot like the average, except they didn't return to baseline. So this is essentially complicated grief. This is life satisfaction, it's not symptoms, but they go down in life satisfaction, they don't return, and each one of those data points is a year. But then we also found this group, 58.7%, that showed essentially no change in life satisfaction. Now you can't see that in the average level data, but that group is in the data set. And then we found these other patterns. This is unemployment, and this looks about right for unemployment. We reanalyzed these data using mixture modeling, and we found there were, again, 4 groups. There's often 4, 3, 5, something like that. These 4 groups reacting with their life satisfaction change in response to the loss of a job, and this group, 68, almost 70%, showed essentially no change. They had a slight dip the year they lost a job. We recently replicated this in an American sample of the health and retirement study, and now we're using depression, so good health is at the bottom, and what we found was 72% showed no change. They had low depressions of the whole study. We also looked at a distal outcome, being reemployed within 4 years, and the people that did not get depressed at any point, the people with low depression, no really depression symptoms, were the most likely to be reemployed. The people who became depressed for the first time were the least likely to be reemployed. Now, all of these studies are with adults. I'm just going to show you a summary slide. And this is a select list of studies. A lot of this is the work coming out of my lab, but there's some other people's work. And this isn't everything. This is just, we made the slide for another paper. But you can see all the different types of events we've looked at with this approach, and you can see that resilience is often very, very common across all of these studies. All kinds of different, there was a mass shooting in here, military deployment, bereavement, hurricane, et cetera. But what about the type of stressor? This was a paper we did for the journal Child Psychology and Psychiatry, and this was actually, this paper was inspired by Anne. I don't think I ever told you that, but this was inspired by Anne, and I think a meeting we did together where I thought about it really hard, and we decided on this approach to try to integrate the literature a little bit. We have minimal impact resilience. This is what I've been showing you so far, acute, isolated events occurring in otherwise normative circumstances, the kind of things I've just shown you. And resilience in this case is a minimal response or a very rapid return to baseline. So it looks like, just like the slides I've been showing you, you have an isolated, potentially traumatic event, the event itself doesn't endure long, and then you have this minimal impact pattern, persistent good health. But a lot of the work in the child area has focused on what we're calling emergent resilience, pervasive and enduring aversive circumstances, poverty, chronic abuse, civil war, et cetera. And in this case, resilience is the eventual emergence of positive outcomes. And it referred to this as when the stressor goes away. So it looks something like this. Chronically stressful event, when you have chronic stressors, it's hard to be perfectly healthy in the context of chronic stress because we wear out. All our stress response system is not really wired for chronic stress. We're very adaptive to dealing with acute emergencies, but biologically we wear out. in the face of chronic stress. So you have symptoms, you have poor functioning, but when the stress is removed, then you have this emergent resilience. So you can see these two patterns side by side, and it's a little confusing without the labels. So these, I think it's even more confusing because they've been in the adult and child literature. So there isn't a lot of crosstalk between the adult and child literature. But they also map onto acute and chronic events. And it just so happens that adult researchers tend to focus on acute events and child development researchers tend to focus on chronic stress. And there's very little crosstalk about that. So since we've been messing with this, we're slowly collecting studies that cut across these lines. So this was a study done in Australia by Robin LeBrock and Paul Canardi. And they looked at children with a traumatic injury who went to a pediatric ER. And these are almost exactly the same findings we have in adults who go to an emergency room for surgery, this minimal impact pattern at about the same prevalence. This is a study I was involved with Stephen Hoffel's group, and this was Palestinians in the West Bank and the Gaza Strip during the second intifada of 2006. And there was just enormous amounts of mass casualty and political violence. And everybody in that study, the stressors were off the charts. And we didn't see the minimal impact pattern. We did the trajectory modeling, but instead we saw these patterns which look like movement toward the normal range. So that would be an emergent pattern. The importance of baseline data. We've devoted an enormous amount of energy to getting baseline data. There's a great short story by Woody Allen on the Heimlich maneuver, on the researchers who invented the Heimlich maneuver, and about their attempt to get pre-choking data. It's very funny if you ever come across it. This was a bereavement study we did in the early 2000s. We actually did have pre-event data for this study. It was one of the first studies. It's a population study that we were able to get this. So without the pre-event data, you see chronic grief, 3 patterns: chronic grief, recovery, and resilience. But with the pre-event data, you see very different patterns. So one of the patterns is chronic depression. You see chronic depression and chronic grief. After the loss, they look very similar. We'd probably lump them together, but they're 2 very different trajectories. And it turned out that predictors of these patterns are very different as well. The other pattern we saw was this depressed improved pattern. This was the first time we saw this. People were not doing well, and then when the spouse died, they moved back into the normal range. This was associated with, you can probably guess, caregiving. Caregiving for a dying person is very stressful. But we've since seen this pattern for all kinds of events. We've seen it in cancer studies, in military studies, where people have a stressor occurs, they're not doing well, the stressor occurs, and then they move into the normal range. I wouldn't call it growth. I would call it just moving into the normal range. The stressor is alleviated. And there was one of my former students just did a study of a mass shooting at Virginia Tech. The Virginia Tech shooting was about 75 mass shootings ago, 2 years ago. And that shooting, they had data, they identified this pattern, and they showed that these are college kids who moved into the normal range. They weren't doing well, the mass shooting happened, they moved into normal range, and it turned out that they had got enormous increases in social resources and social support, and that was probably one of the factors that moved them into the normal range. This was a military study we did with something called the Millennium Cohort Study. I was very lucky to be involved in this study. This was a population study, 77,000 soldiers, up to about 150 now, followed for 21 years with pre- and post-deployment data. It's a remarkable data set. We had this particular study is pre-deployment and then post-deployment twice. And you can see we had 6.7% PTSD. I don't want to get into PTSD now, but I would argue, if anyone wants to talk about it later, that PTSD rates are much lower typically than we normally hear, because this is prospective data, so you don't have sampling bias. And there have been now a couple prospective data sets, and they show rates about this similar. But you can see we also identified a group that, a trajectory of soldiers, a group of soldiers who were not doing well before they were deployed. And without the baseline data, again, you would not know the difference between those two, but they're 2 very different groups. Then 83% resilience in this study, which is kind of remarkable. But these soldiers right at the floor, they had almost no symptoms. We also identified, though, a smaller group that had some symptoms, moderate level, and then got a little bit better. But again, we wouldn't probably see the difference between those 2 without the baseline data. Finally, a couple more of these. So this is the same data set now, one more data point. So this is a 9-year period. And one of the things people criticized us on the previous study was that we probably didn't have combat exposure in the groups. And there were some differences by combat exposure. So we did this analysis just recently of soldiers with combat exposure and without combat exposure. And it made almost no difference on the resilient trajectory. We did a known class analysis as we do these trajectory models simultaneously for the two groups. Resilience was a little bit lower for the combat exposure group, high combat exposure, but not that much different. But the big difference was for this group, the group that wasn't doing well beforehand. The solid red line are those who had combat exposure. So they continued not doing well. The dashed red line are soldiers who were not, they had elevated PTSD in the clinical range, but when they deployed, but they didn't see a lot of combat exposure, and they improved. Now again, without the baseline data, we wouldn't have known the difference between those two groups. One last study, this was a study we did of heart attack and depression. And there's a finding, a lot of this comes from my colleagues in the Columbia Medical School, that people who are depressed when they have a heart attack are more likely to die. So this is a very, very serious finding and really screams for some intervention. But the question was, is it new onset depression or were they depressed beforehand? And you can really only answer that. I don't believe you can ask people those kinds of questions because you get a lot of bias and people are not the most accurate responders. But sometimes there are records. But in this case, we did the trajectory modeling. And what we found very clearly was the group that became depressed was the group that was more likely to die. And the group that was chronically depressed was not more likely to die. And we also found optimism predicted better adjustment prospectively. So we tend to think, now if we think about predicting these trajectories, we tend to think that a few variables are going to be key, and Anne has already covered this. I won't go into this in any great detail. If we do multivariate modeling, we find that there are lots and lots of predictors, all with small effect sizes. Almost, I have not yet seen anything that sometimes they inch toward a moderate effect size. But when you're predicting these trajectories, because you're really parsing the data now in a more fine-tuned way, everything's a small effect in a multivariate model. And that's bad news and good news. It means the bad news is our favorite predictors aren't doing that much. The good news is, and I think Anne said this too, there are many different ways to be resilient. So there are so many different factors that are predicting resilience. There are probably multiple combinations of factors in different people. And that's a very interesting story. And this is without considering moderators yet. So here are just a very quick summary of these things. And this is not, Anne said her list wasn't written in stone. This is not even written on paper. This is pretty wimpy. But we have exposure. Exposure does some things, but exposure are small effects. We have lots of pre-event variables that we can look at and lots of variables that happen after the event. I'm not going to go through this list, but because I want to use the remainder of the talk. About how much time do I have?
You're fine. You got 10 more minutes.
Oh, 10? Oh, all right. I thought I had more. Okay. I want to talk about regulatory flexibility. This is something that we've found as a moderator of stress, but it also is something I'm doing a lot of work on in my lab now. The basic idea is that the literature on, and I'm talking about not cognitive flexibility, but regulatory flexibility, coping and emotion regulation. The basic idea is that these models have been around for a long time. Pamela Cole, who's here at Penn State, did some of the pioneering work, Lazarus, Folkman, James Gross, et cetera. And these models are all about the fit of the person with the changing situational demands. And they're really dynamic models. In theory, though, when this stuff is measured, it's almost always measured in a very static way, as if, that probably has a lot to do with questionnaires, that these factors are adaptive and these things are maladaptive. And those are widespread assumptions. But there really isn't that much data to support that. So in our recent paper, we call this the fallacy of uniform efficacy. The idea that anything is always adaptive or maladaptive. And forgive, these are a little bit silly. I'm an armchair ethologist, but nothing more than that. There's no such thing as a perfect adaptation in nature. Every adaptation has costs and benefits. And one of my favorites is the peacock's tail. I live in Manhattan, and there are 2 peacocks in my neighborhood. And these peacocks can stop more traffic than the Pope. They're really amazing if they unfurl. And this tail unfurls for one purpose. This is a male. This is to get laid, basically, or to produce to get something laid, to get eggs laid. Yeah, that's a better way. It's a better way to put it. But it's most likely evolved for that purpose. Lots of really good research on the peacock's tail, actually, that shows it's tied to genetic fitness. It's a picture of genetic fitness. But peacocks are birds, and they're big, and they're meaty. And if you were eating birds, you would be eating this one. And so it's a real cost to having a tail like this.